guys, welcome again to another episode of Finding Luxury. I'm your host Sherry Kimani. Today we are at Tia Clinics, which is situated in Muthaiga. If you don't know what they do, I will be explaining in a few. Today we are at their 4th birthday celebration and we're going to take you guys around with us. So let's go.
One step 달려와줘 like a little 만 사랑한다고 가져왔던 떨림마저 저 바람결에 사라지는 것.
So guys, we're here with Scholar. She works at Tia Clinics and she's going to show us around. So let's go. Thank you. You're welcome, guys.
시원하게 뻗은 highway road 야자수 아래
Yes, this is our 4th birthday. It started at Sky Mall 4 years ago. It was there for 2 years and then we moved locations to this place. So it's been here for almost 2 years now. Yes. Although there are other clinics in India, so this one is now specifically in Kenya. Yes. Yeah, now this is the lounge area. This is where now our guests wait, maybe enjoying something to drink, relaxing and waiting for their time for procedure.
Okay.
So now this is just an open area because our reception is right there. That's where now people come in, register, make inquiries. Yes. So up here we have our doctor's office, Dr. Ashni Malde, and then we have the procedure rooms. Yes, so in the procedure rooms we have very many different procedures. Right here, it's the doctor's office. Yeah, and so this is where we have the procedure rooms. So here we do different procedures from laser hair removal to hydrofacials to chemical peels to Botox to facelifts, all those, very many. I can't even finish them. Yeah, there's so many procedures.
What is the most famous procedure that Kenyans are getting right now?
Right now, of course, now we have hydrofacial and laser hair removal. At least that one, you know, it's a regular procedure. So you find that patients have to come in every month. So laser hair removal and hydrofacial is more common. Then we have chemical peels, because right now people have started embracing the new method of treating acne. Rather than just using creams, and topicals that sometimes take a longer time. So when you do chemical peels, okay, most of them have been coming in for chemical peels. We have also people coming in for PRPs. PRPs, these are procedures that help in rejuvenation of hair growth.
Oh, nice.
Yes, actually, by the way, it's the leading procedure right now that helps in restoration of hair. PRPs meaning plasma-rich platelets.
Okay, so this is different from this procedure I'm seeing people doing. They put your hair
transplant.
Totally different.
Yes, so now for the transplant we have a different room
you
that
do
is
it
big.
also?
Yeah, we also do transplants. So this is the hydrofacial machine. This is what we use to do the hydrofacial. As you can see, this is a machine that the difference between the hydrofacial and the normal facial is we get to push in the serums with the machine. So the serums are put in.
And it's not dangerous.
It's harmless. You won't feel a thing. No. It is purely harmless. The only difference is at least the serums are pushed into the skin, and then we have the LED lights. They help to exfoliate the skin more. So now this is an advanced method of facial.
Okay.
Yeah.
So when you come here, you come out looking like a baby.
You come out glowing. This is what we use to get rid of the hair. For example, if you have the hair on your legs, underarms, bikini, all that. Yeah, so this is where we do the transplant, the hair transplants. Yeah, so as I explained, we get the hair from the donor area and then we plant, like it's literal. It's like planting grass. It's that literal because at the end of the day, when you plant the hair, you're sure there's something that's there. So even when you're doing PRP or GFC, you're sure you've planted something there. So it's a more sure bet hair restoration procedure, because once you do that transplant and you use the products like mainly Minrich F spray and biotin tablets, and also now the PRPs, now you're sure.
Wait, so you need to get that. Like
so now what happens is, if you come for consultation and we check your hair and we see there's no need for hair transplant, you can just do a PRP and restore your hair, we advise you for that. But if you've completely balded, PRPs won't help you.
Alopecia type of thing.
Now alopecia, they're different. There's traction alopecia and there's now like, okay, what's it called? I can't even remember the name. But the traction alopecia is to the hairline, because of traction, because of pulling, the hairstyles and everything. So that's the most common with ladies.
Tell me about facelifts.
Yes.
Yeah, the one with the thread, is it?
Yes.
Yeah.
Threads. Wow, it's amazing. I've just been in that procedure and it is, you just look at it and you're like, wow. And the results are just amazing, because the doctor will just make inclinations where she needs to put in the threads. So maybe she just places them at a certain angle where she now then inserts the threads. Of course, she'll have to numb you so that at least when she's inserting the threads, you won't feel anything. But it's a purely harmless procedure, and the threads now they dissolve. So you won't be left like with lines. Some people think you're left with like lines and all that. No, it lifts your face perfectly.
So completely like a new face.
Yes, like if you look at the before and after, it's totally
I wish we
different.
got someone who was getting that procedure done so we can see the before and after.
Maybe I'll try and see if there's anyone that will accept to.
Or maybe if you have photos and they agree, we can just
Exactly. So if we can, okay, of course I'll have to speak for the with them for the consent. But if we get one, I'll hook you up.
So Botox.
Yes.
We're talking about.
Yeah. Now Botox is mainly for the smile lines, for the nasolabial, like anywhere where you feel you have like lines, and especially here and here and here. So of course it depends on the units that the doctor finds are enough for you. So that really mainly needs you for consultation. You have to consult first. So when you consult, that is when the doctor will now check your face, see how many units you need, and it's just an injection. It's like, I don't even know what to say beyond it's an injection, because it's just the liquid that is put into the...
one injection, right?
There are many, but they're tiny.
Okay.
It's just a tiny kasindano kenye kanatumiwa, so you don't even feel the pain. That means it's bearable. And again, if you want to look good, you have to bear it. You have to bear it. No pain, no gain. No pain, no gain.
So guys, we're here with Dr. Ashni. How are you?
Good, thanks. How are you?
I'm fine. Your place is very beautiful.
Thank you.
I'd love to know the inspiration behind your clinic.
Started about 9 years ago. I was working in India and I worked for Priyanka Chopra Jonas. She's a Bollywood actress married to Nick Jonas.
One of the most beautiful women in the world, right?
Yes. So she was my boss.
Wow, okay.
And so I used to run their clinic, and I learned about class practice, and so I brought that back to my country. I'm Kenyan, and so of course I wanted to have the same feel here, and this is how I came up with Tia Clinics. We do have 4 branches in India, so of course I worked there for quite some time, but my vision was completely different. I just wanted luxury, not for someone to feel they're in a hospital or a clinic. And this is how I got this place. I don't want people to feel they're walking into a hospital. It's all luxury treatments that we do. So slowly, steadily built it up, for everybody to have access to this kind of facility in Kenya. So I'm that time machine that makes you look 20 years younger.
Awesome. Now, is this something that you always wanted to do when you were small, or did you grow up changing what you wanted to do?
Funny enough, I always wanted to be a maxillofacial surgeon, which is a head and neck surgeon.
Okay.
And I studied that.
Interesting. When you were small, when you were a baby?
Since I was 9.
A face and what? Neck and
Head and neck.
Head and neck.
Yes.
How come?
It's part of dentistry, so you
Okay.
do a bachelor's in dentistry and then do a master's in maxillofacial. And so I only did aesthetics because I wanted to incorporate Botox, fillers into surgery. And I didn't know I would work with Bollywood and, be exposed to the entire Bollywood and understand like this market is demanding. And we didn't have many of them in Kenya at that time. So I said it was rewarding, it was good, so I decided to move back and start the practice here and give the same kind of service, because mostly everybody wants to just go abroad and get all these things done. But you have that now in the vicinity of your home, and it's just easier for you to get things done over here. So it's partial dream, but not a complete dream. But I enjoy aesthetics more than anything else. Yeah.
So what would you say would differentiate you and other clinics that do the same thing that you do? Because there's clinics that are out there that do the same thing.
Yes.
But what makes you different? Like, why should people come here?
Okay, one, this is complete luxury, and that makes it more elite. Also, I run a school at the same time, so I train other doctors, and so I'm passing on the skill to the country. And now that's a skill everybody will be able to have, because clearly I can't treat all the 50 million Kenyans.
Exactly, yeah.
So I'm bringing so much of value to the country. What I've learned, I've put it out on the table, and so that makes me different.
Yeah. And I mean, one thing I noticed about you is that you're willing to teach other people
Correct.
to do what you do. Because
Yes.
like you said, you can't treat everyone.
True.
So that is one thing that I really liked about you, like, because you're open to,
Passing the knowledge.
Yeah, pass
Yes.
it on to other people as well, because you find other people don't want other people to know exactly
Yes.
what they do. So
Correct.
that's really, really good.
Yeah.
So what are we doing here today? Please explain.
We're celebrating our 4th birthday, and so we're 4 years in Kenya now. And so we just wanted to celebrate our patients, so we have everybody coming in just for a small wine and cheese.
Yeah.
And it's just, to acknowledge that I'm here because of them.
Okay.
And I wouldn't be here if it were not for them and their support. I have the best of the patients because they've been with me almost for 2 years, 3 years now, and I give it my all. Yeah.
Okay, another thing I wanted to ask you, what do you think of Kenyans? How are they taking things like Botox, those facial procedures? How do they take it? Because I know Kenyans are very kind of old school.
Yes.
And they're not so open to things like, the Botox.
Correct.
And the hydrofacial.
Yes.
Things like that. They're not open to that because they're so used to the same old thing, like applying creams on your face.
Applying
and
Vaseline.
waiting for it to work. So
Yes.
how do you think they're taking
So initially it was a rough road. People had so much of stereotype in their head.
Yeah.
And they wouldn't even know what is Botox, they wouldn't know what is hair transplants. But with time, I think because of all the awareness around the world, a lot of them are so educated now.
Yeah.
it's been a good journey because now they know what they want, but it's also allowed me to raise a lot of awareness of, okay, like, oh, you need Botox, this is how it's going to work and this is how you'll benefit from it. So we've raised the awareness and simultaneously people have grown. It's not a crazy market like some other country in Africa like Nigeria or South Africa or the US, for example, but we're getting there.
Wait, I want to ask you, in Nigeria, it's a bigger market in Nigeria?
Oh, they're crazy about their looks.
Really?
They will get everything done.
Oh, wow.
And so I'm going to Nigeria end month to train with the institute. And so my co-partner in Nigeria was telling me, you Kenyans don't know anything. You're not bothered. But she's like, the demand we have here in Nigeria is crazy. They want to do fillers, they want to do Botox, they want to do, you know, facelifts, just eyebrow lifts, everything. So I realized that yes, we're a bit backward, but we can build the awareness and people are accepting it. People love my results. So with time, it will grow, and this is the right time because it's going to be a booming industry eventually. Okay, so when I'm training, we charge between 550,000 to 750,000, depending on how long you want the course to be for you. And it's quite economical because when you go abroad, you'll do a 4-day course or a 10-day course for the same amount when I'm offering it for about 3 months. And I give it my all because I don't want quacks out there. In 4 days, you won't be able to learn everything. In the 3 months, and the benefit is because the clinic is here, you visually get to see everything happening. You see the results in front of you. That builds you confidence as well.
Is it a picture or? These are the goodie bags.
Yeah, these are the goodie bags. This is a live gallery. We have an Italian artist called Gianpaolo, and he does all these paintings. And so we sell the paintings here. So if any of our patients wants to pick up a painting, then they're free to, and as we replace, or we also tell them about more paintings that he would have, you can come this way. The beauty of these paintings is they're Mona Lisa paintings. So if you look at her from here, she's looking at you.
Yeah.
As you walk this way, she'll continue looking at you all the way. Yeah. So they're all Mona Lisa and they're fusion. So it's a bit of Italian, European together with our culture, African culture.
And these look so real. Looks like
Yes,
a photo.
yes.
Even that one's a painting.
Yes,
It's not a photo.
they're all paintings. You can see the strokes.
Oh, wow.
Yeah.
So how much does this cost?
This would be going for about $4,000. Yeah.
Like 400.
600.
Oh, now 600.
Yes.
Yes.
The dollar went up.
Wow, amazing.
Yeah. We're the first clinic in Kenya to have paintings, or first hospital in Kenya to have paintings and a live gallery.
I don't know why.
They don't.
Why?
I don't know. I mean, a hospital is a hospital. You have to feel sick when you go there. It has to be green. It has to be smelling of blood.
How come to hospital to get healed?
Exactly. We need to change this concept now.
When you come here, you feel at home.
Yeah.
That's the whole.
You feel alive.
Yeah.